You're against. You're for then repeal of Obamacare, at the very least defund it.
To do whatever we can to put in place a new approach, which is fundamentally based on market solutions, to encourage innovation, to encourage people to expand their healthcare practice, and to empower individuals to control their own consumption of healthcare. Which today in America, people consume healthcare without any sense of its real toll on society, because they have no skin in the game.
That is it, no skin in the game. Let's change gears for a second.
Sure.
And look at, in New Jersey, we have a deficit in primary care physicians. And out of the graduates that we have every year, I would predict maybe 10 to 15% stay in the state. And there's multiple reasons, the taxes that we have in the state. But one reason that's very significant is malpractice. Malpractice insurance, whether you get sued or not sued, seems to go up every year. And when you look at, in Texas, they passed Proposition 12 in 2003. And on average, there's been a decrease in the physician's malpractice payments and hospital payments above 27%. The charity care is, some of the money for their charity care hospitals coming from the savings of their malpractice. As physicians, this is a problem. It's always been a problem. And I feel the lawyers' associations are paying off our politicians to keep this under the gun and not bring it out. So it's time that we have some real malpractice reform. What can we do?
So let's just be clear about this. The trial attorneys have a disproportionate ownership of political discourse and legislation in this country. The fact of the matter is, in a country starved for healthcare resources, we were unable to capture the lowest hanging piece of fruit out there, which is the 20 to 30% of healthcare dollars that are spent either through defensive medicine or the cost of litigation.
And as the lawyers will tell you that that's not true. It is true.
It is true.
And maybe it's higher than that.
Well, look, it's not just the bad doctors. It's every doctor, because the cost of runaway litigation gets socialized or spread over every practitioner. And when that cost becomes too high, as it is for many in New Jersey, those doctors leave the state, which means that there's fewer practitioners or the remaining cost, which doesn't go down, which only accelerates the exodus of doctors from this state. There's no question about it. We need to address, through sensible caps, the runaway costs of litigation. But the other thing we need to do is we need to find a way that that rare 1 in a million case doesn't destroy a doctor's career. So whether it's the unexpected, unusual case that results in a tragedy, a medical tragedy, that could not have been avoided by a doctor. Rather than ruin that doctor and lead to years of litigation, maybe there should be a fund that let's say every surgical procedure pays a very, very small amount into the fund, so that would be settled. The person affected would be fairly compensated for that, but we wouldn't ruin a doctor's career for something that was not predictable. That would be one way to deal with that. The other approach I think makes a lot of sense is we should settle these malpractice claims in medical courts, where they're staffed by people who can judge and adjudicate fairly the pros and cons of the litigation, as opposed to putting them into our general jury system where they take too long and they ultimately cost the system more and probably don't get decided as reasonably as they should. So there's a couple of approaches to manage that effect. I certainly have seen the numbers that doctors are going to Texas. They're even going to California because they're business people. Remember, as we said at the outset, malpractice insurance is a major cost of their business. If they can lower a cost, that is an incentive for them to operate in that jurisdiction. So if the state of New Jersey cannot get its malpractice costs under control, it will only accelerate this imbalance of supply and demand, which is a cost for all of us.
Just to finish up, looking at the healthcare reform, I find some real scary issues with it. You know, we now are going to have to send a 1099 out for anything that costs more than $600.
What does that have to do with health
I
care, by the way?
don't understand it, but
That's
there's a
any
burden.
small business.
Any
That's
small
just us,
business.
And that's the whole thing that's killing us is all the earmarks or the additions to every one of these bills. It's not just healthcare.
And
Right.
scarier, that they hire, who do they hire? 2,000 or several thousand IRS agents? I mean, what does this become? Are we going to now, you know, be checking sending in all this information so that people can check, the IRS can now come, you know, and look at our vendors? I mean, what is this? This is a medical practice.
Right. So again, it goes back to this issue that the people that are writing and approving this legislation are disconnected from the issues that affect people living in the real world. How can any congressman say that the cost, the paperwork cost, the complexity of filing a 1099 for every vendor you do $600 of business with helps the economy? Imagine a small trucking company has maybe 6 trucks. They drive all over the Northeast. They buy gas at hundreds, if not thousands, of gas stations in aggregate, every one of which is probably owned by a different owner because they're all franchised. So you're going to have to track them down, get their tax ID, and send a form for every one of those.
And if you can't do that, are you going to be penalized? Is someone going to come after you and say, wait a minute, you didn't, you know, do the paperwork properly by holding your Medicare payments? I mean, what's going to happen in the future?
It's why we're working so hard for this election. I think they've woken up a sleeping giant, and that's sort of the forgotten American that works hard, pays their bills, supports their charity, tries to raise their kids, and hopes that the government makes their life simple. The government is not making anybody's life simple, and that forgotten American has woken up. They're making phone calls, they're handing out literature, they're probably asking you questions when they come to visit you in this office, and they're mad. They're not only mad, they're angry, they're frustrated, and they're scared. And those are the people that are going to drive a change in America on November 2nd.
Well, Scott,
Thank you so much.
Thank you for coming, and good luck to you.
Good luck.
And good luck with your new venture here at Doctors for Change.
Thank you very much.
Thanks a lot. Well, it's like Ron